Welcome to the Operatory Podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me today, like always, is the man himself, David Bryan. How are you doing today, sir?
Bryan Laskin, how's it going? I haven't seen you in forever.
I know. We're 6 feet apart, but we're still doing the podcast. It's amazing. This is during the COVID-19 shutdown crisis, which has been a surreal experience. Days just kind of blend together, and hope everybody out there is safe and doing well. How are you holding up, my man?
I'm doing pretty well. I'm really busy, as you know.
Yes, it's been pretty busy over here at the Opera Pad, even though I've been the only one coming into the office. But our teledentistry application has been just exploding. It's been a bit wild. Yeah. And I have to point out, dude, your shirt.
Yes.
Dave, of course, being Dave, came in today wearing
a Corona shirt.
A Corona beer shirt. Yes, which and you have multiple energy drinks while you're drinking your Corona or in your Corona beer shirt.
Well, you got to counteract it somehow.
I suppose that is true. Well, thanks, man. Thanks for coming into the office to actually do the podcast and then head out. It's good to see you.
Yep.
And today we have a very important topic, I think, which is what's the worst case for the dentist during this crisis, the COVID-19 crisis. And I think it's important to talk about because dentistry, I believe, has been affected as much as any industry. Because there's obviously, I don't want to overstate the impact, but it's in this weird spot. If you think about like hospitals that are overloaded, obviously that's much more, it's much more dramatic and it's horrible what's going on at hospitals where nurses and doctors are working nonstop and making difficult decisions every day and they don't have enough PPE. Then on the other end, you have companies that are just shutting down because there's too much going on. But in dentistry, we're in this sort of weird space where we're really essential services. People need to have their dental work done. But probably the best way to spread the disease around would be having people put their hands in other people's mouths, then go to somebody else and do it again. And so we're in this weird area, I think, which is why the ADA, the state associations, the governors are talking about dentistry. I was just on the local news yesterday about teledentistry because it's, if you think about it, we're sort of the hot spot of what could be a negative trend. And so this podcast, I wanted to just do a call out to all the dentists out there who are seeing people for emergencies. Thank you very much. It's important to get people out of the hospitals and so let your patients know that you do see patients for emergencies so that they know that you're there for them. But then also, I want to talk about when we do open up, which will probably be around when this podcast comes up. It sounds like people are going to start opening up in about 2 weeks across the country. I was talking to a colleague of mine in Texas who they're going to open up and starting to open up in 2 weeks. And what scares me is I'm seeing online dentists that are going to go back to work like business as usual of a month and a half ago when we closed. And I don't think that's wise.
Oh, good.
Yeah, because we like I said, what's the worst case scenario? The worst case scenario is that you're, as my friend Christy Peel, who's been on her tagline for her company Media Mindful, she's been on the podcast before, is famous in a good way. If your office is the epicenter of an outbreak, that's not the good way kind of famous.
No.
Yeah, that's the you might as well just hang up, give the keys back to the landlord, and walk home and find another job. So we need to keep ourselves safe and our patients, but also, I mean, just pragmatically, even if to get ahead of this, make sure that you're on top of the. And it's a challenging situation because there's not enough PPE to go around. So we're looking at N95. We're sterilizing N95 masks using a UV sterilizer upstairs. We have Dr. Gallo coming on the podcast, who's going to talk about PPE and infection control, because I think it's vitally important. I think for us to get the message out there to dentists that this is not this is not time to ignore, bury your head in the sand, and go back to business as usual.
So I'm doing, because of the teledentistry app, I'm doing 11 to 13 demos a day. And so I'm talking to a lot of doctors right now. And certainly the resounding message that I'm hearing is that things will be different in a post coronavirus situation. That's the message from the people that I'm talking to.
100%, but they're the ones that get it, right? They're the ones and probably the ones that are listening to this podcast get it.
Yep.
But still need to get the message out there
Right, yep.
because it's important. And I think, the people that are raising their hands saying, "Oh my gosh, I get it." Right now, we need to triage emergencies, and we can't do that over the phone. Right. I had to stop. Like I was on a thread online, trying to convince people to use teledentistry to triage emergencies instead of the phone. And oh my gosh, the hate for all these middlemen. And I'm like, what are you I mean, first of all, like the pre-screening form that we have they send out. So when a patient needs to come into the office, we have people text or email a pre-screening form that has the 3 questions that the ADA has asked for. Have you traveled internationally in the last 14 days? Have you or a family member been diagnosed with COVID-19? And then about the signs and symptoms. And we're hearing from people all the time saying that patients are saying yes to all 3 questions and planning on coming in. It's like, no, hospital time for you before you come in, right? And so, I mean, this is vitally important. If let's say somebody comes in who they walk in your office, they touch everything, oh, hello, I'm here. And they grab the clipboard, the pen, and they fill it out. And then they're like, oh, yeah, by the way, yes to all 3 questions. Okay. Yeah. Germaphobe.
Well, they might as well lick
here.
the iPad on the way out the door.
Exactly. It's like, no, get those questions answered outside the office, right? Yep. I mean, so this is vitally important. I mean, this isn't playing around because that one person then goes to the next person, your receptionist or gets sick, mm-hmm. and then guess who just became well, let's follow the trail back to where the epicenter is. Oh, it's that dental practice, right? I mean, look, I'm no Nostradamus, but I would bet that somebody's dental office after this is going to be on the news for being like the center of an outbreak. It wouldn't surprise me at all.
Right.
And so don't let that be you. Right.
Well, and the call out is really to help the industry, right? Like if that one dental office gets national exposure to being the epicenter of a big problem, it's going to be a big problem for all of you.
Yeah. Well, 80% of people, I mean, think about the news articles that have really gone nationwide in dentistry in the last decade. I'm thinking of a big one was you don't have to floss, right? People are like, dentists are, there's a... when in our industry, 80% of people are fearful of us, right? They're looking for ways to not come in,
right?
And this would be a very big one, and it would if there is an office where they can trace it back to that office. That's not going to be just small. Like I was on the local news talking about teledentistry. That's not going nationwide,
right?
If, however, our office becomes the center of an outbreak, God forbid. Well, that would be nationwide for sure, right? Yeah. So do what you and it's not easy at all because there's not enough PPE to go around. So I mean, I should bring up and read what the governor, the Minnesota Board of Dentistry send out a notice about it. It's like, well, make sure to use whatever you have, but it should be a N95 and a face mask or something else, or it's like. Because there's no good answers. I keep talking to the office manager upstairs, and she's like, "Well, are we just going to reschedule these people and then reschedule them again?" And I'm like, "Yeah." I'm like, "There's no good options, so the only options we have are the best of the worst ones, right?" And that's what it comes to PPE right now. So now's the time to start planning. Like if you are 2 weeks away or 1 week away or you just started, the best time was 2 weeks ago. The second best time is now. Yeah. So, and so, we'll put up the podcast right after this one with Dr. Gallo so that you can learn about what the research that's going on between about scheduling or sterilizing PPE, because I think it's very important.
Yeah.
I think, and from your perspective, providing the patient perspective, I feel like for a long time, maybe, months, I don't know if it'll be a year or whatever, but I think we're going to be in the confidence game about getting patients back into our offices.
Yeah, I think because I think it'll certainly be perceived as a lot of it is elective until you're in massive pain, right? And so getting patients back on a regular schedule, if that one office becomes the hot zone of COVID, then yeah, you're going to have a lot of trouble getting people in for their checkups, right?
Oh, that office is
that one's done. But I mean, all dentists, right?
Yeah.
And so tell your friends, right?
Yeah.
Like get on it, and so
and I think more important, like tell your patients and your teammates right now what you're doing, like the plan that you have, and how you are changing your infection control protocols and how you're on top of it. I think it's going to be important to let people know. Don't keep it quiet.
Yeah.
I think this is the time to be out there talking to people about what you're doing and how you're leveling up to address this crisis. And do your part. And right now it's staying home, but pretty soon it's going to be wiping every surface and letting that disinfectant soak for 15 minutes, which. We're I know at our office we're definitely gonna be leveling up our infection control protocols.
Buy stock in Cavicide.
Yeah, that's already been baked in. I think that ship has already sailed. Who knows? I said that about the iPod after like the first iPod. I'm like,
you say that about Disney. You say that about Apple.
Disney's a good buy right now.
Yes, go buy it.
Well, on that note, I'll leave you off. But thank you, Dave, very much. Appreciate it as always.
You got it, Brian. Have a good one.
You too.